Good morning, everybody. I appreciate you joining us today. As most of you know, I'm Tony from Mercy Perrysburg Family Medicine Residency in Perrysburg. And as we do the third Wednesday of each month, give a talk on a different medical topic. And today we're going to talk about taking care of your skin. Sounds simple enough, but it's really something that we really tend to overlook some things from time to time. So hopefully, by the end of this talk, you at least learn a couple of things or kind of a couple of things to watch out for. On the back, the second page does have products listed. We'll talk about some of them. I'm not going to endorse one over the other, but at least we'll get a chance to better familiarize ourselves with some of those things. It's difficult to ignore aging. We often look in the mirror and start to say, wow, I'm starting to notice some more wrinkles, or I'm starting to notice some age spots. Or we take a look at a person. It's funny in the medical field, when we talk about patients, we'll say, oh, they're a young looking 80-year-old, or they're a old looking 70-year-old, just based on appearance. And I think a lot of that tends to be skin. There are certainly genetic and environmental factors that go into our skin conditions, and we'll talk a little bit about that. Probably one of the biggest environmental factors is sun. Smoking and sun exposure are probably the two biggest causes of wrinkles. But I think it's important to know a couple of things. Number one, our skin requires a lot of maintenance. Our skin is the largest organ of our body, and there's different layers of cells. And the other thing that's important to know about our skin is that we all have melanin, and melanin is what gives us our color. So obviously, darker complected people have more melanin as compared to other individuals, but we start to lose that melanin over time. Our skin also provides many different functions. It provides protection. Certain areas of our skin are thicker than others. We've talked about this when we're talking about heat and summer precautions and winter precautions, about our lips and around our ears and around our nasal openings are all very thin. Even our forehead is, compared to other parts of our skin. So those tend to be the things that you might see the first types of problems. My father-in-law, who is 83, just had skin surgery twice already this year to remove some cancerous spots on his ears and on his face. So a lot of that's probably from years of playing golf and stubborn men not wearing sun protection and things like that. Our skin also helps us to regulate our body temperature. It protects our bones, and it also serves as an early warning sign against other diseases. Our skin stops to redevelop itself after about age 30. So we're kind of feeling invincible up to about that point, but we really need to start to concentrate a little bit more on what's required. And my take-home message in this talk is basically our skin requires maintenance in 4 different areas. Number one, to keep it clean. And I'm talking about all areas of our bodies. Now, we may not have the ability as we get older to reach down and get in clean between the webbing of our toes, and the soles of our feet, or get to our back. But we need to, work with our doctor about some type of adaptive equipment that we might be able to use. Sometimes there are sponges with longer handles that we can kind of use for things like that. But we want to make sure that we're cleaning all areas of our body, particularly if we're a little bit overweight and under the rolls of our skin and things like that. Number 2 is keeping it hydrated. How do we do that? 2 ways. Number 1, drinking plenty of water, and making sure that we use a moisturizer. And we'll talk about that here in a little bit. The third thing is to keep it from itching. We're going to talk about some different types of skin conditions, but we want to make sure that we are there's a difference between a mosquito bite and then having something like psoriasis where it's dry, itchy skin, and we do a little bit of this, and the next thing you know, we've irritated it a little bit more, so we're scratching more, and all of a sudden we're leading to a skin tear because again, our skin is going to lose elasticity over time. So younger individuals, you can kind of pinch the skin and it'll bounce back in place. Older individuals, you pinch that same skin and it's going to kind of take a little bit longer to fall back in place. So that skin's a little bit more thin, it has less elasticity, and you're more prone to skin tears. So we want to keep it from itching so that we don't do that. And the third thing is keep an eye on it. And we're going to talk about what that means in terms of the A, B, C, D, E about our skin. Some common skin conditions are number one, probably for older individuals, we get a lot of people coming in the office with skin tags. It's just one of those things that develop. There's a lot of home remedies to get rid of skin tags. Some people like to get it done at the doctor's office. The problem with the doctor's office is Medicare typically won't cover the procedure to remove skin tears unless it creates some type of significant inconvenience or problem. So sometimes you want to say if it's cosmetic, your doctor's not going to remove it. But if it's something more significant that's creating a problem, your doctor might be able to find wording or a code or something to kind of be able to move forward in getting that done. The next thing is dry skin. A lot of times, dry skin is a result of, like I said, losing moisture. We don't do ourselves any favor by taking hot baths or hot showers, or using certain types of over-the-counter cleansers in that, because a lot of those may tend to remove additional moisture from the skin. What we want to do, like I said, in addition to hydrating, is keeping it moisturized. The best time to moisturize is when you get out of the shower or the bathtub. Making sure that you don't take your towel and that you're rubbing yourself vigorously to get dry, but kind of patting dry, and then using one of those moisturizers because your skin's pores are still a little bit more open and they can absorb it. One of the things you want to try and do when you're purchasing moisturizer is making sure that you do your best to make sure it's fragrance free. We might like the smell of lavender or who knows what other scent is out there. However, some of those can be irritants. The other thing I encourage people to do is if you're going to try a new product like that, just put it on a small patch of your skin and kind of watch it for a few days to see if it's an irritant, because we've had people come into the office who are like rashed all over, and we're like, well, what's happening? I don't know. About the only thing I can think of is I bought this new moisturizer or I bought this new cream and I put it on and your body's not reacting well to it. So always trying something out in moderation first. Another thing that we tend to experience as we get older are nevi, which is just a fancy way of saying moles. Some of these can be somewhat natural, but some of these can also be precancerous growths. So those are the ones that we want to look out for when we
Got a Pepsi delivery here.
okay.
And we got donuts, by the way.
Okay, well, we're giving a talk, so
Okay, go ahead. Taking care of your skin. What's that? That's one that I missed. I'm gonna have to.
okay. You want to park that somewhere so I can finish my talk?
Well, I'm gonna try to do it.
Okay, you do it while I'm giving the talk. I don't want to hold these people up. So we want to watch these moles, and we're going to talk about the A, B, C, D, E in here in a second. Psoriasis is just a fancy way of saying dry skin. Dry skin can happen for numerous reasons. One way that we tend to get dry skin is seborrheic dermatitis, which is this fancy weird way of saying dandruff. So we want to make sure that we are keeping an eye on our scalp as well. Sometimes we'll get dry skin around our eyebrows and around our eyelashes, particularly if we wake up in the morning. A lot of older individuals tend to get that.
And if you don't wake up in the morning, you got a problem.
You're right. So we want to make sure that if you do have that dry skin around your like eyebrows and your eyelashes, one good thing to use is baby shampoo. Something like Johnson's baby shampoo. We use that a lot in older individuals, particularly who are in nursing facilities and that. Just a little bit on a cloth, of course, obviously keeping your eyes closed, but getting a little bit of a lather, a little foam, and then rubbing it gently and then rinsing it properly is definitely a way to help. With dandruff, there are some over-the-counter things like Salsa Blue and Head and Shoulders and that. It may work for a couple of individuals, but there's different types of dry scalp. So we want to make sure that if you're going to use that, maybe buying a small travel size bottle first as opposed to something bigger. If it doesn't work, you might need to talk to your doctor about a more significantly medicated type shampoo. Contact dermatitis is something we see a lot. This is something where you buy a new shirt or you buy new bed sheets or something like that, and then all of a sudden you wake up in the morning or at the end of the day, you notice that you got a rash from here all the way down to your trunk. Well, it's probably the new shirt that I have on, or something in the material or in the production of that thing, or the same way with your sheets. If you've got, depending on how you lay in bed, if you wake up and you're noticing that. So I always try and point to some type of new clothing article if it's contact dermatitis. It's something that can be rectified fairly quickly. Seborrheic keratosis. These are basically what I was talking about initially, the non-cancerous skin growths on the face, neck, chest, back. These tend to be the spots that we want to keep the most eye on, because this could be something like an age spot, or it could be something that is starting to develop into something more serious. And that's what we want to watch out for, because that's something more serious is skin cancer. There's basically three types of skin cancer. Basal cell, which is the most common, probably 8 out of 10 skin cancers are basal cell. Squamous cell tends to be the next most common. That's probably, well, I said 8 out of 10, so that's 80% of people. 20% tend to have squamous cell, and then the most severe is the melanoma. That's the most dangerous. What are some of the things that we can do? Just a quick thing, and I think it goes without saying. Excuse me. I need to grab my water here.
Like a Pepsi?
No, I'm good. Thank you. First thing is obviously if you're a smoker, to quit smoking. This interferes with the blood flow, natural blood flow of our skin. It helps to cut down on wrinkles. The other thing we want to do is make sure we're checking out our bodies. Just trying to not, we get up to that mirror and we can only see pretty much from the neck up, but trying to get into a full length mirror, or as you're patting yourself dry, are you noticing something that is a little bit abnormal, maybe a spot you haven't seen before? And then again, don't forget to check your feet and your scalp. Now we get into the A, B, C, D, E of things. If you go to that bottom of that second page, you're going to see what tends to be like a normal spot and what tends to be an abnormal spot, something that's more cancerous. A is asymmetry. Is the size of it the same all the way around, or is it something that we are seeing that there's some irregular size to it? B is borders. Is it the same on both sides, or are the borders a little bit more jagged? You can see if these are nice. Hopefully it comes out on your copy, but you can see how things are a little bit more even on the top and a little bit more uneven on the bottom. C is color. Is that spot all one color, or are you seeing some variations in it? Is it maybe darker or really, really red in the middle? Does it have a white spot, or is it kind of faded around the edges. D is diameter. Most things should be about a quarter inch at best. So if you think about a pencil eraser, on the tip of a pencil tends to be about a quarter inch. Is it something that's growing in size? Excuse me. Is it something that's staying the same or is it growing in size? And then it kind of goes hand in hand with A, B, C, D. Is it evolving? Is it staying the same? You know, sometimes I've even seen people who took a little permanent marker and maybe drew around. They do it with rashes as well. They'll draw like an area of a permanent marker around a rash and then check it in a day or two to see if it's decreasing in size or if it's expanding beyond the perimeters of what you did with the marker. Same holds true sometimes. People do that with other spots that they might see. So those are kind of the take-home messages, things you can do for yourself. Obviously, if you're seeing things that are concerning, certainly schedule an appointment with your physician to get that looked at a little bit more in depth. Pages 3 and 4 just have some moisturizers there, some skin cleansers as well. Again, I'm not endorsing one or over the other. There are a couple on here that I know are very good products that I did not put in terms of moisturizers. Eucerin, I don't think is on there. And Aveeno's on there. There was another one, CeraVe. That's the other one I didn't put on there. Expensive products, they're very good. But again, everybody needs to think about what their income limitations are and what you can spend on.
Aquaphilic is one of the best.
There you go. And again, I appreciate people sharing, what works for them. What worked for you may not work for me, but it's worth a try if what you've tried up to this point hasn't worked. It's always good to consider another one. The final thing is sunscreen. If you go into Kroger's or Rite Aid, or I don't know if Rite Aid's around anymore, Walgreens, Walmart, there's this whole row of sunscreens and it numbers from 30 to 70. Which one's best for you? At a minimum, you should be using sunscreen that is 30. And you should be applying that every 2 hours if you're going outside. Even if you don't see the sun shining, the ultraviolet rays are still going to penetrate through the clouds and have an effect on your skin. So making sure that we are, again, still using that, paying attention to the weather. I think the weather these days, as opposed to when we grew up, they told you the temperature. That was it. Now they tell you the heat index. They tell you the UV level and everything else. So I think it's made us more informed so that we can better decide how do we need to dress and what do we need to apply and how often when we go outside. So I'm going to keep it at that because I'm a tiny bit under the weather, but hopefully you found some of this to be helpful. Next month is reducing the risk of falls. Yours truly is going to be back one more time to present those. I think after that, then all of our resident physicians will actually be coming in. But as faculty, I have to pull up the slack, and that's okay because it's always good to see everybody. Any questions?
I have
Yes.
one. The under eye bag,
Mhm.
all of a sudden it's developed over age.
Sure.
Or with age. How do you take care of that so it's not so prominent?
Do you turn on the TV between the hours of 9 a.m. and 5 or 6 p.m.? They're gonna. I was in Las Vegas one time, and they're like waving me over, and I actually have a picture on my phone, and they're like, "Oh, you've got these bags," and I've had them all my life. Part of it is my sinuses. You just can't avoid it. But what they did was they put it on one, and my wife looks, and they're like, "Yeah, there's really a noted difference." And they're like, okay, now it's gonna cost you, $175 for, I go, what about the other one? Well, it's gonna cost you $175. And it's just a temporary skin tightening thing,
Right.
to taunt your skin a little bit, but now I saved myself $175, and for the rest of the day, I walked around with one look like this and one look like this. I mean, it just,
Did they ask permission?
oh yeah, they did. Did I have to sign a consent? No. Did I take a risk?
Isn't the implication if they're gonna do one, that
Well,
is.
yeah, but I'm kind of glad he didn't do both, because what if I had a skin reaction? Now I have two, and that's what I'm talking
Yeah.
about in terms of, trying on a new product and making sure that,
So
it works
basically
for you.
live with it.
But yeah, a lot of those things tend to be cosmetic. I just saw one last night about somebody's talk about the crow's feet under their neck and that. Exactly. It's about, who are you doing this for?
Right.
And some people are willing to do Botox and all these other things.
Yeah.
But what are the long-term risks versus benefits?